right, good morning. We're going to do a full head-to-toe physical assessment. Miss Kelly is going to work with us today. So remember your order of assessment technique. With all body systems, first off, think about, for instance, with your head. We're not going to auscultate our head, but you would use inspection and palpation. So always remember the general order of your assessment technique is inspection, palpation, percussion, then auscultation. Except when we get to GI, your order should always be inspection, then auscultation, then percussion and palpation. So do not forget your order of assessment technique. So I'm just going to start from the beginning. Come in. Good morning. My name's Miss Mobley. I'll be your nurse today. Can you please tell me your name and date of birth?
Kelly Liburn, 12492.
And what brought you in today?
Pneumonia.
Pneumonia. Do you know what facility you're at?
University.
Okay. And can you tell me what day of the week it is?
It's a Tuesday.
Tuesday. So Kelly, you're alert and oriented times 4. What I'm going to do right now, I'm going to do a head-to-toe assessment. I'm going to start up here and literally go to your toes. Before I start, are you in any pain? No pain? Do you need to use the restroom?
No.
Okay. All right. So I'm first going to just look. We're inspecting. Her hair is evenly distributed. Look. No drainage in her ears. No skin breakdown behind her ears. Open your mouth, please. Her teeth are intact. Mucous membranes are pink and moist. I like to pull down their conjunctiva. Her conjunctiva is pink. There's no drainage. Okay. So, Kelly, what I want you to do is look straight at me. Follow my pen. So Kelly's eyes, her pupils are equal and round. They react to light, or they constrict when I shine a light in it, and they are accommodating, meaning her pupils will adjust focus or constrict or dilate depending on where an object is. And then we saw convergence. When I bring the pen light in, her eyes cross, okay? All right, well now I'm going to move down to your neck, and I'm first going to inspect. And the head of the bed has to be a minimum of 30 degrees to inspect JVD. I am looking. She has no jugular vein distension, which is good. Her jugular veins are flat. I actually see carotid pulsations. Next, I'm going to palpate her carotid pulses using light pressure. You never palpate carotid pulses at the same time. And there is an auscultation component we have to do for the neck. We need to auscultate for carotid bruits. You need to ensure that you use the bell of the stethoscope. So Kelly does not have any bruits present. We do not want bruits. That means turbulent blood flow. I did hear her S1 or S2 at her carotid pulses. So now we're going to move down to cardiac and respiratory. You would want to expose your patient with permission to see the whole chest. And first we inspect. A lot of things we need to inspect about respiratory. Her chest rise and fall is even and symmetrical. She has no oxygen use. She has no accessory muscle use. She's not breathing with her neck muscles. She's not breathing with her abdomen. Her anterior to posterior diameter, if you look, is 1 to 2. If we were to expose her chest, we should not see any pulsations up here. So I'm inspecting. There's no musculoskeletal deformities. I will then palpate. Please let me know if you have any tenderness when I'm touching you. So palpate her thorax. You should not feel any pulsations. There should not be any tenderness. You can feel at the apical pulse, and you might feel a slight pulse. I can feel Kelly's pulse. If you are to palpate a pulse, this is the only place that is normal to feel it. And next, it is not required of you all to percuss, but if you want to practice percussing, you can percuss the entire thorax. again, when we percuss, we want to assess the density of tissues. We want to see if they're fluid filled, or do they have air in them, or is it dense? Could it be a mass? So that's the purpose of percussion. And then we're going to auscultate. It is expected that you auscultate 5 points for cardiac using the diaphragm. I'm going to call out the locations. So you're going to find the second intercostal space, right of the sternal border. That is your aortic. You just need to listen and hear bum bum. Here, left up, and then you go over second intercostal space, left of the sternal border. That is pulmonic. All you need to hear is bum bum. So go down third intercostal space, left of the sternal border. That's Erb's point. Fourth intercostal space, left of the sternal border. That's your tricuspid valve. And then last, we want to do our fifth intercostal space. Split your left clavicle in half. Go down to your fifth intercostal space where the nipple line should be, and lift up any breast tissue that's in the way. And you would listen for a full 60 seconds to calculate your heart rate. While you are auscultating cardiac, if you hear anything abnormal in any 5 points, it is expected you flipped over to the bell side and then re-listen to all sounds. All right, Kelly. Now I'm going to sit you up. If you don't mind, sit on the edge of the bed. I'm going to auscultate your breath sounds. Be mindful, depending on your patient's tolerance. We want you to auscultate all lung fields. We just say the standard here is 8 in front, 10 on back. However, if your patient cannot tolerate breathing that long, you do not do that. Our patient safety is always priority. So we need to think about our lung fields. We have our bronchial lung sounds, which is up here. Bronchial vesicular, which is close to your sternum over your mainstem bronchi. And then your vesicular. It's all the periphery lung sounds. So I am just going to auscultate 8 points, making sure I hit all the way, all lung fields, 8 on the front, 10 on the back. It is imperative that you listen for the full inspiration and expiration with the diaphragm. Take a deep breath. Kelly's lung sounds are clear in all lobes. I would then pop around to the back. And what I'm going to do is I'm actually going to have her turn so we can see. Put your legs up on the bed. There we go. You wouldn't do this with a real patient. It's just for video purposes. So, 10 on the back. Think about how your lungs are shaped and just follow that lung path. You have a big muscle up here. We want to start right below the scapula, the bone. Remember, listen for a full inspiration and expiration. Deep breath. Very good. And do you see, Kelly is a young, healthy woman, and even after taking all those breaths, you can get a little short of breath. So we need to make sure that our patient can tolerate that amount of auscultation. Always be mindful that you are staying in the lung fields. Don't go down here and you start listening to bowel sounds. So you can feel for the ribs to ensure that you're in the lung fields. All right, thank you. If you don't mind laying all the way back for me. Now we're going to start with our GI assessment. The best position for the bed to be is flat. Always, again, be mindful. Can your patient tolerate the head of the bed being flat? So before you start your abdominal assessment, again, I've already asked her if she was in pain or if she had to use the bathroom. I would again just reiterate, are you sure you don't need to use the bathroom? Have no pain? What was your last bowel movement? Yesterday? What did it look like? Normal? Was it brown and loose? Brown and hard?
Brown and hard.
Okay. And then urination, how did it look?
Clear shallow.
Clear shallow, no pain, no discharge? Okay. So we always first start with inspection. I am inspecting. We want to see flat or rounded stomachs. I'm looking and Kelly has no abdominal distension. You would expose the stomach. You could look for striae or stretch marks, or we want to ensure that the umbilicus is midline. So we've inspected our abdomen. Do not forget your next step is auscultation. You are not to palpate then percuss. It could affect bowel sounds. So we want to split our abdomen into 4 quadrants. I always start in the left lower quadrant. As soon as you hear a bowel sound, you can move on to the next quadrant. I hear a bowel sound. That took about 5 to 10 seconds. Hear a bowel sound. Hear a bowel sound. Hear a bowel sound. So I auscultated active bowel sounds in all 4 quadrants. Your next step, if you are going to percuss, again, it's not a requirement, you can percuss the abdomen. And last, we will palpate. We need to ensure that if Kelly had any abdominal pain, that we palpate that area last. Let's pretend she had left lower quadrant abdominal pain. I would start over here and palpate her entire abdomen. We get to that area of pain last. If we started with that area first, she would become tight and rigid her entire abdominal assessment for palpation. So again, Kelly's abdomen is soft, it's non-distended, and she had active bowel sounds in all 4 quadrants. And sit your head of the bed back up. And the last thing we're gonna do is check her extremities. All right, we're gonna use the acronym of Good Morning Students, Please Eat the Chocolate Cake. Always compare extremities bilaterally. I like to do upper extremities, then do lower extremities. And throughout this entire process, I should have, of course, exposed the body with permission, and I should be looking at skin throughout the entire process. So I'm gonna start with our upper extremities. So good morning stands for grips. Please squeeze my hands. Kelly's grips are strong and equal. Movement, can you move your arms for me? Please, thank you. Good morning, student. Sensation, do you feel me touching you? Her sensation's intact. Good morning, students, please. We're gonna check pulses. For the upper extremities, you need to check the radial pulse. Her pulses are +2 bilaterally. Eat is edema. When I was checking sensation, truly, I see that she has no edema. I can feel her temperature, it's warm. I can see that her color is appropriate for ethnicity, so it kind of covers a lot of things, but we'll just keep in the order that we're going. So good morning, so grips, movement, pulses, sensation, pulses. Good morning, students, please eat. Edema, T is for temperature, her temperature is warm. And chocolate cake, color appropriate for ethnicity. And we need to ensure that the last C, we do cap refill. We want to press down on the fingernails and ensure that cap refill is less than 3 seconds. If they have nail polish on like Kelly does, you can actually press right below and it will still blanch, and we want to see that it's less than 3 seconds. So for the bottom extremities, for grips, can you please push down on my hands? Good, move your legs please. Sensation, can you feel me touching you? pulses, it is expected that you check both the dorsalis pedis pulse at the top of the foot. We need to compare them bilaterally. And posterior tibialis in the inner ankle. So E stands for edema. She has no edema. T stands for temperature. Her skin is warm. And then color is appropriate for ethnicity. And then I would check the cap refill and 1 digit on each extremity. Last, we want to ensure musculoskeletal. We always want to see them walk if we can see them walk. You don't have to have them get out of bed, but we do want to assess their gait. We like it to be smooth and steady. We'll always need to verify if there's any assistive devices. Do you use a walker or a cane?
No.
Any hearing aids? Okay. No glasses?
Yes, I wear glasses.
You wear glasses? You would document that. And you always do your skin overall. If I assess, for instance, her abdomen and I saw a scar, I would document it then. But overall, Kelly's skin is clean, dry, warm, and intact. And I can document that at the end. If you have an immobile client, you need to look at their butt. Always flip them over to ensure that we don't have any breakdown, especially in their bottom and any bony prominence, like your elbows, your heels, anything like that. All right, thank you.